Welcome to our presentation on assistive technology. This group presentation is by Andrew Allen, Nguyen and Sarah Hazel. What is assistive technology? Assistive devices and technologies are those whose primary purpose is to maintain or improve an individual's functioning and independence to facilitate participation and to enhance overall well-being. They can also help prevent impairments and secondary health conditions. An important element of occupational therapy intervention is providing assistive technology devices and services to support individuals, improve their performance, and increase their participation for their activities. Some examples of the numerous products and services that occupational therapists might recommend include mobility aids such as wheelchairs, walkers, crutches, or prosthetic devices, hand or grab rails positioned in key places around the home or workplace, toileting or bathing / showering aids, and customised cooking equipment. When is assistive technology used? Occupational therapists can introduce or suggest assistive technologies to a wide range of people. If an individual is struggling with mobility or a disability in an environment that they are familiar with, then an occupational therapist may suggest assistive devices to help. Some examples of when/where assistive technology is used and how it can benefit a particular person can include: at home, occupational therapists often visit people in their homes to assist them in making their living environment more comfortable and accessible. This can range from selecting appropriate assistive technology or recommending particular modifications for an individual's situation. For example, introducing adaptive equipment such as a single hand jar opener, kettle tippers, and cutting boards to assist whilst cooking. At work, occupational therapists use specialised assessments to determine the functional requirements of various jobs and people's capacity to return to the workplace. Occupational therapists can assist with modifying or enhancing the work environment to suit the needs of individuals so as to prevent or minimise injuries and ill health. For example, supporting someone with arthritis in their hands and wrist by introducing a specialised keyboard and mouse whilst working in the office. And at school, assistive technology options are available to students at school to assist them in their learning and development and make it easier to communicate and participate with their peers and teachers. Some devices commonly suggested by occupational therapists for school children with physical or intellectual disabilities can include magnification tools, speech-to-text tools, screen display adjustments, literacy software, and communication tools. Why is assistive technology used? Technology has an important place in our daily life. Occupational therapists use technology to increase their occupational performance, participation, promote greater independence, and health of individuals. One of the main aims and reasons for the use of assistive technology is to reduce the help and reliance on other people so that an individual can support themselves and live independently. Assistive technology greatly enhances the quality of life for both people with and without disabilities. Not only do people with physical, sensory, or cognitive impairment make use of these devices, populations such as seniors and pregnant women can also be of benefit with the use of assistive technology.
Funding agencies such as the NDIS often require assistive technology assessment to support application for assistive technology. Such assessment can be done by an occupational therapist to show how the technology or supports are the most appropriate and that they are reasonable and necessary. Occupational therapists frequently use activity analysis to consider the tools and equipment necessary for clients to engage in a specific activity. Different frameworks and models, such as the HAT model, can be useful to make sure that we look at the human and activity perspective of how an assistive devices can help someone and the context in which those devices operate, such as what movement and abilities are available, or what the client wants to achieve, or what environments the client wants to have controls in, or what the clients prioritize. There are a number of different types of assistive technology, and to simply the assessment process a little, the NDIS split assistive technology into 4 different levels, and they will provide assessment template for each level. The cost of assistive technology will decide if an assessment is required and which type of evidence is required. With level 1 basic assistive technology, assessment is usually not needed, and those basic items usually cost less than $1,500 and is safe to operate and use with no specialized assistance needed. Examples include non-slip bath mat or mobility canes. At level 2 standard assistive technology, standard assistive technology is not customized, but they require some assistance setting up and making adjustment. For example, transfer benches, laundry or washing line, adaptation and handrails. At level 3, specialized assistive technology, this type of item often require some adjustment or modification to suit the individual. Examples include stair lift and pressure mattresses. At level 3, complex assistive technology is those items are custom made and is often require ongoing support, including training. Examples include powered wheelchair or bed rails and hearing aids.
Now that we know when occupational therapists should be involved and the types of assessments and interventions used, we should now next be looking into the evidence around assistive technology and improving occupational performance. There is a considerable body of evidence concerning how assistive technology improves occupational performance. However, we should first define what occupational performance is. According to Shapara and Raker, occupational performance is the ability to perceive, desire, recall, plan, and carry out roles, routines, tasks, and subtasks for the purpose of self-maintenance, productivity, leisure, and rest in response to the demands of the internal and/or external environment. In order to determine how clients and/or their caregivers mark improvements in occupational performance, occupational therapists would use an assessment tool such as the COPM. This is used to collect data between 2 points in time from the client and/or caregiver. The first is the baseline score, and the second or comparison score is recorded after an intervention, resulting in either an increase or decrease in scores across the marked domains. Having established how we get the evidence, we will now look at various studies from the assistive technology field. Sasolza et al. Found that in children aged between 8 to 11 years old who had Fragile X syndrome, that using assistive technology, there was marked improvement in the baseline scores when the intervention was used and further improvement with an additional intervention. When looking into non-pharmacological treatments for clients with osteoarthritis in their hands, Amaral et al. Conducted a randomized controlled trial and found that from the 19 patients in their intervention group, a significant positive score change was observed in occupational performance when compared to the control group. In one study, Malcolm and Roll studied the outcomes of students with a less apparent disability, or one with few if any physical signs, including ADHD and ASD, when using time-assisted devices to compensate for difficulties with time processing. During the study, the participants used assistive technology such as alarms and weekend schedules. Over the course of one semester, COPM scores increased across the occupations of reading, writing, note-taking, test-taking, and studying, increasing significantly. People who become tetraplegic, also known as quadriplegic, can be trained in using assistive technology for computer access. Polan et al. Conducted a study of patients using related assistive technology such as computer hardware, for example trackball mice and microphones, software, for example Dragon Naturally Speaking, as well as finger splints, and using them for computer-based occupations, for example social media, playing games, online banking, and work. The authors found that 3 main themes had emerged: that the participants were able to get back into their lives by returning to meaningful roles, including returning to work, that the assistive technology assisted in participants adjusting to their injury by overcoming physical barriers and making sense of their altered self, and by learning new and valuable skills.